at SOHO, we discussed several points and several issues open in myelodysplastic syndrome treatment. And my task was to discuss the novel therapy in lower-risk MDS. This is the field in which we had more advance in the last, let's say, couple of years. So the most important point are given by the efficacy of two drugs, namely Luspatercept and Imetelstat, in the treatment of anemia of low-risk MDS. So low-risk MDS are in the great majority of cases characterized by anemia that may be also quite severe and require red blood cell transfusions. And because these patients have a longer survival, they will have to face years of transfusion. So one of the goals is indeed to avoid transfusion, improving hemoglobin. Not only that, but by these, we realize that we may prolong survival. And you may say this is more important in high-risk MDS that face shorter survival, but indeed, even lower-risk MDS patients do have an expectancy of life much shorter than the one of their age-matched healthy population and healthy controls. So, having said so, I presented the data related to the COMMANDS trial. The COMMANDS trial is a study that investigates the activity of Luspatercept in patients who have low-risk MDS, excluding MDS with del(5q), who are transfusion dependent and who have never received any other treatment. So Luspatercept is approved for transfusion-dependent low-risk MDS in second line and now also in first line, thanks to these data. And the comparison in Luspatercept versus erythropoietin, and the endpoint is to verify transfusion independence at 12 weeks, accompanied by an increase of 1.5 gram deciliter of hemoglobin. So this is the original study. What am I telling new now is the fact that increasing hemoglobin level is also accompanied by a significant advantage in survival. So patients who have been treated with Luspatercept and ISA for more than 2.5 years do have a difference in survival. And this is especially notable at the landmark of 36 months, in which none of the treated patients, none of the two arms has reached median survival. But indeed, the survival of Luspatercept-treated patient is much longer. So this is something incredibly important for our patients, because that means that not only you improve their quality of life, but you also improve their life score. And another important thing is that if you reach levels of hemoglobin that are not just above the threshold of transfusion, but are near normal, like more than 10 grams deciliter, then the duration of response, and in second analysis also the survival, is much improved. So this is something that we have to keep in mind. We do not only eliminate the symptoms, but we want to improve the general condition and the life of our patient. And then I presented again something that it's impacting on the anemia and on the life of patients with low-risk MDS. That is the use of Imetelstat. Imetelstat is also an approved drug, and it has to be stressed that this drug is an IV versus the sub-Q of the previous drug, but this is an agent that is extremely active in patients who have a high transfusion burden. So these patients do not respond to treatment with Luspatercept. But if they are treated with Imetelstat, 40% of them can achieve transfusion independence. This means that this subgroup of patients, again, MDS low risk, excluding MDS del(5q), but they do need to, included in the study. They did need to have at least 4 and more red blood cell units in 8 weeks. The majority of them had actually more than 6 red blood cell units transfused in 8 weeks. So these patients, as I was saying, respond in 40% of cases, but they do respond for a very long time. The majority of the patients who respond and have a transfusion independence longer than 8 weeks, in 70% of cases they will have a response lasting for 6 months, and the majority of these patients achieving 6 months will have a transfusion independence longer than 1 year. Not only that, but their level of hemoglobin is not above the threshold of transfusion. It's not 8.5 gram deciliter. It's normal level. So they may have 13 gram deciliter, meaning that they may have a very good quality of life and lead their lives as before being sick in terms of fatigue and symptoms. So these are, I would say, the most important 2 drugs that have been revised and restudied. Imetelstat, as a difference, has a potential disease-modifying activity. It decreases the dysplastic clone, and it has been shown by the decrease in the variant allele frequency of the most frequent mutation presented by the treated patients. So it has to be investigated further, but it's really a promise, and it seems to be the unique drug doing this, having this effect. And having said so, there are further novelties that are the use of target therapy in lower risk MDS. The French MDS group has piloted a study that is still ongoing using inazidenib, so the anti-IDH2 inhibitor, in patients who lost their response to ISAs. And as much as few patients have been treated, the response rate is 55%. So it seems to be very active, whereas the IDH1 inhibitor ivosidenib for lower risk MDS is still under investigation, and few patients have been treated, very few actually. So I think that the combination of these different drugs, it's a good premises to have very good results and increase the success of treatment for transfusion-dependent patients. We still need to attack, I would say, the other cytopenias.